Hi, I'm Camille from Pareto Education and welcome to our YouTube channel. Now, if you're a healthcare professional getting ready for a home visit, this video will talk you through the key steps to prepare you effectively. Whether you're a GP, nurse, paramedic or PA, being organized can make the difference between a safe, thorough assessment of your patient and a rushed, incomplete one. So let's get into it. Always start with your equipment. Before leaving, double check that your medical bag is properly stocked. You'll want all the essentials: blood pressure monitor, pulse oximeter, thermometer, stethoscope, glucometer, PPE like gloves and masks, and basic wound care supplies. Depending on your role, you may also want to carry some emergency medications such as aspirin, salbutamol, or even glucose gel. Don't forget your laptop or tablet with access to clinical records. So here's a quick tip: make equipment checks part of your daily routine. Restocking in the last minute helps avoid last minute delays and panic at the time of the home visit. Next up, patient preparation. Before setting off, spend a few minutes reading the patient's record. Look at the recent consultations, hospital discharge summaries, key diagnosis of the patient, what currently medication they're taking, allergy status, and any advanced care plans. For example, whether the patient has a do not attempt resuscitation order, or a respect form, or a palliative care plan. Try to understand the context. Are they normally independent? Are there carers involved? Have there been any recent falls or missed appointments? This background is what helps you anticipate what to expect on your home visit. For example, if you're visiting a diabetic patient who has recently had a hypoglycemic collapse, you'll want to know their insulin regime, their latest HbA1c, and whether they live alone or with others. If you're worried about connectivity or battery life of your laptop, you can also print out a one-page summary. This is just in case. When you arrive at the home, think safety first. Make sure the environment is secure, not just for the patient, but also for you. Let someone know where you're going, especially if you're going alone. Beware of any trip hazards, pets, any aggressive behavior, and then you can begin your assessment. Start by taking the full observations of the patient and take it from there. Look beyond just numbers. For example, is the patient alert? Are they breathless on exertion? Are they able to mobilize? Key questions such as, are they eating and drinking? Always pay close attention to the environment. Is there any food in the fridge? Are there any unopened medications piling up in the house? Is the house warm, clean, or does it feel neglected? Are there details that can indicate these unmet needs with social or safeguarding support needed? For example, if you visit an elderly patient living in some squalid conditions with no family support, this might trigger you to refer to social care, even if it seems that their medical issues might be stable. When going through a physical exam, be pragmatic, but you have to be thorough. You're working without a couch, good lighting, or an assistant. Do what's essential to cover your clinical question. For example, if your patient is breathless and you suspect heart failure, listening to the chest and checking for ankle edema may be all part of your clinical assessment. Intimate exams such as rectal or pelvic should only be done if absolutely necessary and likely to change the management. For example, if you suspect a bowel obstruction and need to check for impacted stool, document the rationale clearly and obtain verbal consent. Always preserve the patient's dignity. If it can safely wait for a clinic or hospital setting, then delay and refer appropriately. Now let's talk about management. On your findings, create a clear plan. This should include the starting treatment, say for example you're prescribing antibiotics for a chest infection, or you're escalating care if you're concerned. If you're treating them at home, ensure the patient understands the diagnosis, what to expect from treatment, and when to seek help. That's your safety netting. For example, if you've diagnosed a mild COPD exacerbation, explain to your patient. If your breathing worsens or you can't speak in fluent sentences, call 999. If you don't start improving in the next 48 hours, call the practice. This allows the patient to know what they should do next. If you're leaving medication, make sure they understand the dose and also how long to take it. You may want to leave written instruction if possible, especially if cognition or literacy is a concern. And finally, always document thoroughly. Record your findings, the working diagnosis, the plan, and your safety netting advice. If there are any concerns like safeguarding or capacity, flag these early and inform the relevant team members. Home visits give us a unique insight into a patient's world. You'll learn things you'd never from a clinic visit, and how they live, how they move, and what support they really have. With solid preparation, a comprehensive yet practical approach, clear documentation, and clear communication, you can deliver outstanding care beyond the four walls of the surgery. Thanks for watching. If you found it useful, please do hit the like button and subscribe for more real-world clinical tips. Thank you and goodbye.